will be enhanced through checks and balances between the executive, the legislature, and the judiciary.
As COVID-19 continues to threaten the health sector, another health worker has succumbed to the virus. David Orare, a clinical officer from Kisii Level 5 Teaching and Referral Hospital, died last night. The total number of clinical officers that have succumbed to COVID-19 complications now stands at 7, while the number of health workers has risen to 33. The Kenya Union of Clinical Officers has now issued a 14-day strike notice beginning tomorrow. The union wants the government to allow its senior and vulnerable members to be released from official duties, even as the virus continues to spread.
It's baffling why somebody should just sit and watch our senior-most experts, our teachers, who are actually supposed to teach the next generation of our medical professionals, actually succumb from this disease without doing anything. And I think we came here 7 days ago, and we gave them a demand letter, an ultimatum of 7 days, of which they have turned a deaf ear. We have got no response from any of the employers on this, and our vulnerable members especially, they continue to be exposed because of negligence, because this can only be termed as negligence from the employers. And that is why we are here today, to now give a strike notice. Because we actually have only two options we have here. It's either we give a notice, we withdraw the services, and then the government can put its priorities in order, or we can look on and pretend nothing is happening, and then you'll see health professionals abandon duty, like it happened in South Africa some months ago, like we saw in 2015 Ebola in West Africa, where I led a team of Kenyans. And so sometimes when we give these advisories, we don't give them as political statements. Some of us have got experience. I think about 4 weeks ago from Nakuru, we were the first one to raise the alarm and call on the president to stop political rallies. And we told Kenyans that if this was to continue, by now the hospitals will be full. And you'll
The government has been challenged to fully reopen schools to avert the rising cases of teenage